Next, let's move on to time management. Okay, so under time, there are a few things that you need to improve on. Okay, so the first one is reading time. Okay, this is the first point. So reading time, as you know, for the online and the face-to-face AMC clinical examination, it's 2 minutes of reading time. The art of a good time management is to know how to read the stem and the task in one go. Okay, because sometimes you can have a very long stem. You cannot take your time to read it, or you cannot read it twice. That's a danger because you may not understand everything. At the end of the day, sometimes it's quite challenging to understand everything, but there are a few tips that you can use. I will make a video on how to, really maximize your reading time. Okay, I will show you that on that video. But the short tip that I want to tell you here is always start with the task. When you're doing the reading time, start with the task, understand your task, summarize your task. The first one is history, second one is diagnosis, third one is management. Understand that and then move on to the STEM. Okay, then you perform more efficiently. The next thing is assessment time. Why this is very important is obviously this is where everything is being measured. Okay, this is the game time, right? You're going to perform, you're going to show your best at that time. Okay, that's where your marks are going to be awarded. The most important thing here is that you need to make sure that you don't miss any task. Okay, and during your assessment time, you got to allocate time, according to the task that you have in that station. What that means is you start with your introduction, you do your task 1, your task number 2. Some station might have 3 tasks. Then you finish your third task and you end with a thank you statement. So you got to keep practicing that until this sequence is smooth. All right. The next thing is a task division. What I mean is trying to divide your task not equally, but trying to divide your task in a way that you can complete the entire task that AMC gives you within 8 minutes. So you must be good at that. The only way is to do role plays and keep practicing and improving from that point. Okay. So let's move on to the next point in the time management. Here, my next point is station specific. So what I'm trying to convey here is there are some stations where you can finish your assessment time quicker. So for example, a counseling station is something that I find quite easy to finish on time, because if you follow certain mnemonics, like for example, the 6C, the C for cat, 6 C's, you finish that, if you use that and the plus 4R, okay, 6C plus 4R, R for rabbit. So when you do that, you will tend to finish on time. Okay, so I did not have much problem with that. But there are other stations which I find it quite challenging, and I can imagine that you'll be able to relate with me on that. For example, a physical examination station or a full station. A full station is a station that has history, diagnosis, and management. So when you have a station like that, you got to be a lot more quicker. You got to recognize from reading the STEM and the task. When you see your station, when you're looking at the task, you got to tell to yourself, what station is this? Is this a diagnostic station, a full station, or a physical examination station? Because if it's one of these stations, then you got to be faster. Okay, if it's a counseling station, you got to focus on communicating nicely with your patient. So this is how you got to manage your time. All right. So before we end with the time management, there's one more point. The point that I want to mention here is the difference between an online and a face-to-face exam. So remember we went through the difference between an online and a face-to-face exam. They both have their advantages on time. Okay, the online exam has its own advantages. The physical examination, for example, in the face-to-face exam, if you're doing a physical examination, sometimes you can be a lot quicker because you don't have to explain too many things. You just have to perform. And if your performance is smooth, then obviously you can finish on time, better. But the online exam, you're not performing, you're talking the physical examination. So you got to practice, speaking quickly or speaking in a way that you can complete the physical examination. So for example, in that case, the online exam may have a disadvantage in time and the face-to-face may have an advantage in time when it comes to a physical examination. So there are many other things similarly like that, for both this online and the face-to-face. So you need to keep practicing, find out what is the advantage and disadvantage. And if you know a disadvantage, you got to work on that. Make sure that you're smooth on the disadvantages for your own exam type. Okay, so I hope these things are helpful. I'm going to move on to the next point.